In this video, you will come to know about PCOS, which is a common issue among women. A study done in southern India and Maharashtra found that PCOS affects 9.13% of menstrual women there, while polycystic ovary disease affects 22.5%, and among US women of reproductive age, PCOS accounts for 6% to 12% up to 5 million cases, making it one of the most prevalent reasons for female infertility. Unfortunately, Pakistan has a substantially high rate of PCOS-affected women, around 52%. And according to estimates from the World Health Organization, PCOS affects about 116 million women worldwide, that is 3.4%. So the question is, what is PCOS? Polycystic Ovary syndrome is a condition where the ovaries produce an abnormal amount of androgenous male sex hormones that are usually present in women in small amounts. The name Polycystic Ovary syndrome describes the numerous small polypid sacs that form in the ovaries. However, some women with this disorder do not have this, while some women without the disorder do exist. So, how does PCOS affect ovulation, egg production in females? A mature egg discharges from an ovary during ovulation, and this takes place so that the male sperm can fertilize it. But during your periods, the egg is expelled from the body if it is not fertilized. But in PCOS, a woman may occasionally produce insufficient amounts of the hormones required for ovulation. The ovaries may grow a large number of tiny cysts when ovulation is absent, and androgens are hormones that these cysts produce. Androgen levels are frequently elevated in women with PCOS, and this may worsen a woman's menstrual cycle issues. And many of the symptoms of PCOS can be brought on by it. Infertility in women with PCOS is typically caused mostly by ovulation issues, and a rise in testosterone production or immaturity of follicles on the ovaries may prevent ovulation. Even if ovulation takes place, an imbalance in hormones may prevent the lining of the uterus from correctly growing so that the mature egg cannot be implanted. When should you visit a doctor? If you have started experiencing irregular periods, having difficulties becoming pregnant, and showing signs of excess androgen, including male pattern baldness, acne, new hair growth on your face and body, a decrease in breast size, and oily skin, then consult your doctor immediately. How is PCOS diagnosed or identified? Your doctor will inquire about your medical history as well as your current symptoms. You will also get a physical examination like a pelvic exam, which will probably be part of this. This examination evaluates the condition of your reproductive organs both internally and externally. Some of the symptoms of PCOS are similar to those of other medical conditions. As a result, you might also undergo tests like ultrasound. In this test, blood vessels, tissues, and organs are realized using sound waves and a computer. This examination examines the size of the ovaries and sex forces. The endometrium, the uterine lining, can also be examined during the test to determine its thickness. Blood tests. These scans look for androgen and other hormone concentrations that are elevated, and your blood glucose levels could also be checked by a medical professional. Additionally, you could get your triglyceride and cholesterol levels examined. How can PCOS be treated? What are the medical ways to treat PCOS? A variety of factors affect how PCOS is treated. Your age, the severity of your symptoms, and your general health will be examples of them. Whether you intend to get pregnant in the future will also affect the type of treatment you receive. If you intend to get pregnant, you might receive the following treatments: a shift in diet and exercise. You can also lose and lessen your symptoms by eating while engaging in more physical activity. They may aid in ovulation, decrease blood sugar levels, improve insulin sensitivity into your body. If you're planning to get pregnant, then ovulation-inducing drugs will be recommended. The ovaries can normally release eggs with the aid of medications. These drugs come with certain hazards as well. They may raise the possibility of having twins or more during pregnancy. They can also stimulate the ovaries excessively. At this point, the ovaries overproduce hormones. It may result in symptoms like pelvic pain and bloating in the abdomen. If pregnancy is not in your future, that is, you're not planning to get pregnant in future, you might receive the following treatments. Contraceptive tablets. These aid in regulating menstrual periods, bringing down testosterone levels, and clearing up acne. Medicines for diabetes to reduce insulin resistance in PCOS. This is frequently used. Additionally, it might aid in lowering testosterone levels, reducing hair growth, and promoting more frequent ovulation. A shift in diet and exercise. You can lose weight and lessen your symptoms by eating well and engaging in creative physical activity. They may aid in ovulation, decrease blood sugar levels, improve insulin sensitivity in your body. Medications for treatment of other symptoms. Some drugs can help with acne or hair growth. Thanks for watching the video. If you didn't subscribe my channel, then click on the subscription button. Also leave a comment on my video so that I come to know from where you are watching my video. If you want to know about the causes and symptoms of PCOS, then click the link given in the description below.